Clinics and drug shops have lately become quite common in many neighborhoods around the city. But the personnel who run such facilities sometimes end up ruining the lives of the patients who seek medical attention from them. In 2013, close to 80 facilities were closed down in Kampala alone for operating illegally. Many of the clinics failed to meet the basic health and safety standards set out by different councils.
And a few, of course, would find that because you've had a little bit of association of work in the laboratory, you find them trying to give out some of these results. But the majority, what we are finding out is that people were actually not renewing their licenses, or they are actually never even registered. The next was hygiene, whereby you find there is no flowing water, there is no privacy for the patients.
The Uganda Medical and Dental Practitioners Council, which regulates the activities of doctors in the country, investigates at least 40 cases of malpractice at any given time.
Where people have got injuries, sometimes death. You had a case in Zimbabwe where somebody was administered to a soda instead of ordinary fruits and whatever. But also so many children have got paralyzed limbs and whatever. Some have died.
There is a lot of respect for the health professionals. It's one of the cardinal professions where people are still looked at as God, because when I come to see you, all my hands are, my health is before you. Now, it has been abused in most cases, not just by the health professionals themselves, but also by the unscrupulous persons that pose as health professionals.
Some of the preconditions for clinics and drug shops to operate include having the facility run by the registered supervisor with a practicing license. Additionally, the supervisor must have a clean track record. The facility must have proper waste disposal management and operate in a clean and safe environment.
Look for availability of water, availability of power. Is the floor actually cemented? Is there enough natural light? If you have a laboratory, do you have a sink? Do you have a disposal mechanism for buckets and so on? Do you have infection control procedures in place? Do you have an autoclave to actually make sure that you can boil your instruments?
But quack doctors still manage to operate despite the stringent regulations set by the authorities.
The challenge is that midway the year, or even after the first quarter of the year, when the health professionals have submitted all these requirements, the practice is very different. They end up living into clinics or drug shops, the unqualified staff, because in most cases, these health professionals are either working in one or two facilities, so they may not sit there in full time.
The government is coming up with a law to regulate other practitioners who are not in our field. And sometimes we have found that they have gone in the area which is not theirs. But you find somebody who has done a reflexology, then he wants to treat heart conditions.
Inspections have now been intensified by different stakeholders, thanks largely to new laws of the National Drug Authority and KCCA Act that allow the immediate prosecution of anyone found in the wrong.
It allows them to immediately, if they find a mistake, to cross. Hours, you need to pass through the steps, warning the quack and writing the letters, which actually is long-winded and it doesn't deliver the results which people expect from the councils immediately.
The Medical and Dental Practitioners Council is planning to monitor over 1,800 clinics around the country this year. With this huge responsibility ahead of them, they are calling on the public's support to improve the state of affairs.
But when we go to close, you find that the local leaders don't want those quack practice to be closed. And in so many cases, even in Kisenyi one time here, we were surrounded when we came to close the clinic which had been reported.
Look out there and actually are their licenses hung up? Are these people actually authorized to practice? You actually have no harm in asking somebody whether they actually have the license to practice.
Besides looking out for a license hung up on the walls of a health facility, you could also use your phone to find out if the person treating you is qualified. Just type in doctor, then their name, and send to 8198. Then you'll find out all the details of that physician as well as the facility you have walked into. Irene Namyalo, NTV.